Today, we're going to gain your confidence back with 100 quick NCLEX facts that you should know before taking your exam. After each statement, I'll pause briefly, but feel free to pause the video if you need more time to think about it. Let's get NCLEX ready. Statement 1. The classic sign of Kawasaki syndrome is strawberry tongue. Statement 2. The classic sign of systemic lupus erythematosus is the butterfly RAS. Statement 3. To decrease intracranial pressure in a client with a head injury, the head of the bed should be elevated to 30 degrees. Statement 4. When in Rome, respiratory is opposite and metabolic is equal. With respiratory condition, the pH and PaCO2 are opposite. With metabolic condition, the pH and HCO3 are equal and go in the same direction. Statement 5. Miotics constrict the pupil. There's an O in miotics and constricts. Statement 6. Mydriatics dilates the pupil. There's a D in mydriatic and dilates. Statement 7. Know the rules of 9 to calculate total body surface area for burns. Head is 9%, chest is 18%, back is 18%, arm is 9% each, leg is 18% each, genital area is 1%. Statement 8. Anticonvulsants are ordered for seizure management or for bipolar disorders. Statement 9. A client experiencing epistatus should lean forward, not backward. Statement 10. A client with pulmonary or air embolism should be placed on the left side with the head of the bed lowered or in Trendelenburg position. Statement 11. Sterile procedures, such as dressing changes, can be delegated to the LPN. Statement 12. A high-calorie and high-protein diet is the common diet for an underweight client. Statement 13. The classic sign of intussusception is the sausage-shaped mass that is felt during abdomen palpation. Statement 14. Stable clients can be delegated to the nursing assistant. Statement 15. If the pulse is less than 60 beats per minute, do not administer digoxin. Statement 16. Anti-anemics are ordered to increase blood cell production. Statement 17. If maternal hypotension occurs after an epidural anesthesia, know the treatment and stop. Stop infusion of Pitocin. Turn the client on the left side. Oxygen should be administered. Push IV fluid if hypovolemia is noted. Statement 18. The therapeutic drug level of digoxin is 0.8 to 2.0 ng/ml. Statement 19. The antidote for warfarin is vitamin K. Statement 20. The classic sign of pernicious anemia is red beefy tongue. Statement 21. Critical clients should not be assigned to the LPN or the nursing assistant. Statement 22. Do not delegate what you can eat, evaluation, assessment, and teaching. Statement 23. To determine if the client is dehydrated, monitor the client's weight. Statement 24. The classic sign of glaucoma is tunnel vision. Statement 25. If the client is in distress, medication administration is rarely the first choice to choose. Look at the other options first. Statement 26. Beneficent is performing a duty that benefits someone and the duty to do no harm. It is based on the client's overall interest. An example is providing comfort to a sick or dying client. Another example is taking client surgery pro bono. Statement 27. Non-maleficent is the duty to do no harm. It is based on the client's best medical interest, whereas beneficent is based on the client's overall interest. An example is stopping a medication that is causing harm. Statement 28. The classic sign of emphysema is barrel chest. Statement 29. Do not administer antibiotics without checking for allergies first. Statement 30. Vaccines should not be given to neutropenic clients. Statement 31. The classic sign of measles are conflict spots, which are multiple spots of white lesions noted on the buccal mucosa. Statement 32. A LPN can be delegated to monitor clients that have IV therapy running. Statement 33. Restricted potassium and restricted phosphorus diet are the common diets for a client with chronic renal disease. Statement 34. Dopamine treats cardiogenic shock. Statement 35. Never give potassium by IV push. Statement 36. Digiban is the antidote for digoxin overdose. Statement 37. Tetracycline should not be administered at bedtime. It is taken with a full glass of water. Do not lie down for 10 minutes after. Statement 38. The classic signs of pulmonary tuberculosis are a low-grade fever, weight loss, coughing with blood, and chest pain. Statement 39. Do not give morphine to a client with pancreatitis. Statement 40. Protamine sulfate is the antidote for heparin overdose. Statement 41. Projection is displacing feelings onto a person, animal, or object. An example is getting yelled at by your boss and then coming home and yelling at your spouse or pet. Statement 42. Carafate should be taken before meals. Carafate is prescribed for duodenal and gastric ulcer. Statement 43. Tagamet should be taken with food. Tagamet is given to relieve and prevent heartburn and acid indigestion. Statement 44. Antacids should be taken after meal. Antacids are also given to relieve and prevent heartburn and acid indigestion. Statement 45. The classic signs of deep vein thrombosis is Holman's sign. Just keep in mind that this is not very reliable and not the diagnostic confirmation of deep vein thrombosis, since a positive result can also be noted in clients without deep vein thrombosis. Statement 46. When giving loop diuretic, watch out for potassium depletion. Statement 47. Propranolol should not be given to clients with bronchial asthma. Statement 48. Food with tyramine should be avoided if the client is on MAOIs due to the risk of hypertensive crisis. Statement 49. Naloxone is the antidote for opioid overdose. Statement 50. Glucagon is the antidote for beta blockers overdose. Okay, that was the first 50 NCLEX quick facts. You can get a glimpse of how effective my digital flashcards are for the NCLEX quick facts, like the ones in this video, when you grab your 160 free digital flashcards at cutieNurses.com/start. While you're here, smash that red subscribe button below to stay updated with all our latest insight and tips. Let's get NCLEX ready together and go over the next 50 NCLEX quick facts. Statement 51. When selecting an answer, avoid the ones with absolutes such as always, never, all, every, only, must, or none. Statement 52. After the administration of Ritalin, heart-related side effects should be assessed and reported immediately. Statement 53. Amiodarone should not be double-dosed if missed. Statement 54. Wheezing on expiration is a sign and symptom of asthma. Statement 55. Encourage an increased diet of vitamin B12 or pernicious anemia. Statement 56. Increase fluids for hydration due to sickle cell anemia causing dehydration. Statement 57. Bronchodilators increase airflow to the lungs by dilating large air passages, which is useful for asthma or COPD. Statement 58. Methotrexate is used for chemotherapy and for rheumatoid arthritis. Statement 59. Know your medical math conversion. 1 kilogram equals to 2.2 pounds. 1 teaspoon equals to 5 milliliters. 1 tablespoon equals to 3 teaspoons, which is also equal to 15 milliliters. 1 ounce equals to 30 milliliters. 1 cup equals to 240 milliliters, which also equals to 8 ounces. 1 quart equals to 2 pints, and 1 pint equals to 2 cups. Statement 60. Know how to calculate the correct amount to administer. Amount to administer equals dose over half. So the number of tablets equals 400 milligrams over 200 milligrams. So the answer is 2 tablets to administer. Statement 61. Do not give grapefruits for Buspar, Tegretol, Simvastatin, and Verampiramil. Statement 62. Maslow's hierarchy of needs should be prioritized from bottom to the top. Physiological needs, safety needs, love and belonging, esteem, self-actualization. Statement 63. Words that indicate prioritizations are best, next, most appropriate, immediate, essential, initial, vital, most important, highest priority. Statement 64. Choose unstable before stable. Unstable includes change in condition, acute, unexpected, new onset, newly diagnosed, critical lab values, hemorrhage, and change in vital signs. Statement 65. Anticholinergic effect is when the patient will not be able to spit, pee, poop, or see. Statement 66. A stable patient is someone with chronic condition, expected findings, ready for discharge, consistent lab values, consistent vital signs, and conditions that have not changed. Statement 67. Avoid asking patients why questions. Statement 68. Dumping syndrome occurs 15 to 30 minutes after eating. Statement 69. Encourage ambulation after a post-op to prevent the development of deep vein thrombosis. Statement 70. To prevent atelectasis and other respiratory complications, encourage the use of incentive spirometry. Statement 71. Get comfortable with identifying drugs, side effects, contraindication, and how to administer medications. Statement 72. Select answers that are least invasive first before jumping to the most invasive answers. Restraints are rarely the first choice before other interventions are attempted. Statement 73. After a post-op or procedure, assess the airway, potential altered mental status, sepsis, and hemorrhage. Statement 74. A patient with cystic fibrosis should be encouraged to have a low-fat and high-sodium diet. Statement 75. Carbamazepine is contraindicated within 14 days of MAOI administration. Statement 76. Focus on the present by focusing on the problem in front of you right now before the potential problem that could occur in the future. Statement 77. Crystalloids are the fluid of choice for sepsis. Statement 78. Guillain-Barré syndrome classic sign and symptom is ascending muscle weakness. Statement 79. Hirschsprung's disease classic sign and symptom is ribbon-like stool. Statement 80. Avoid Asian ginseng and ginkgo with NSAIDs. Statement 81. ABC. Prioritize the patient's breathing and prioritize what is affecting their airway, breathing, or circulation. Statement 82. Acetone breath is noted in someone with diabetic ketoacidosis. Statement 83. If a quadriplegic patient is experiencing autonomic dysreflexia, elevate the head as high as possible. Statement 84. Bladder issues are the most common cause of autonomic dysreflexia, so the bladder should be assessed. Statement 85. Avoid grapefruit with calcium channel blockers. Statement 86. Prioritize the patient before the machine. An example is prioritizing the patient's safety before the dialysis machine. Statement 87. Classic signs and symptoms of typhoid are rose spots noted on the abdomen and chest. Statement 88. Angina's classic sign is a crushing and stabbing pain that is relieved by nitroglycerin. Statement 89. Myocardial infarction's classic sign is a crushing and stabbing pain that radiates to the left shoulder, neck, and arm that is unrelieved by nitroglycerin. Statement 90. Avoid excess milk, hot beverages, and alcohol with enteric-coated pills. Statement 91. If there is a mass casualty, triage the patients that are most likely to survive first. Patient 92. If the outflow is affected during peritoneal dialysis, turn the patient side by side before looking at the tubing or the machine. Patient 93. If a patient on dialysis has a fistula that does not have a bruit or thrill noted upon palpation, do not cannulate. Patient 94. A patient with chronic kidney failure should be on a limited fluid diet. Patient 95. An answer that delays patient care is usually the incorrect answer. An example is reassessing the vital signs in 30 minutes. Statement 96. If a patient is on dialysis for the first time and reports itchiness and rash, stop the treatment immediately and do not return the blood back. Statement 97. Someone with celiac disease should be on a gluten-free diet and avoid barley, rye, oat, and wheat. Statement 98. Avoid whole milk before 12 months of age as the child can be placed at risk for intestinal bleeding. Statement 99. Questions that require prioritization, eliminate the answer that results in doing nothing. NCLEX will not put questions that require you to do nothing when a patient is in need. Eliminate choice that include answers similar to continue to monitor. And last but not least, Statement 100. GTPAL stands for gravida, term births, preterm births, abortion, and living children. G is gravida, which is the number of times a client got pregnant. T is term birth, which is the number of times a baby has been born, 37 plus weeks of gestation. P is preterm birth, which is the number of times a baby has been born between 20 and 37 weeks of gestation. A is abortion, which is pregnancy losses before 20 weeks. L is living children, which is the number of children that are living. Awesome job on completing all 100 NCLEX quick facts. Don't take the NCLEX until you're comfortable with these 100 statements. Looking for more tips and tricks to make your journey even more fun and engaging? Check out my next video where we dive into more essential nursing school hacks. Thanks for dropping in and see you in the next video.